part 8, breaking down the components of the psychiatric evaluation, and you are currently here. So getting into the mental status exam, the MSE. So this is the objective snapshot of the patient's mental status at the time of the current evaluation. And you're going to do an MSE at every single patient appointment. We're looking at appearance, behavior, psychomotor activity, their attitude and cooperation, their speech, their mood, so which is subjective into how they're feeling, their affect, their thought process, their thought content, any perceptual disturbances, their cognition, insight, and judgment. For this video, you're going to have to pause and take notes because my hand would be cramping if I had to write this all out. Appearance, grooming, hygiene, attire, nutrition status, any self-harm, scars, behavior, motor activity, any abnormal movements, mannerisms, posture, restlessness, how's their eye contact, attitude and cooperation, are they engaged, guarded, pleasant, or maybe they're hostile. Speech, we're looking at the rate, volume, amount, quality, fluency, tone, and any latency. Mood, patient's self-reported emotional state, how they would describe their mood, sad, worried, overwhelmed, nervous. Patient's affect, are they flat, blunted, full, restricted, their intensity, appropriateness. How's their thought process? Is it logical, linear, goal-oriented, organized, intact, flight of ideas, or concrete thinking? Then thought content, this is what the patient is actually thinking about, the content. So SI, HI, obsessions, phobias, delusions, thought insertion, thought broadcasting, and then perceptual disturbances, so the hallucinations, illusions, depersonalization, derealization. Getting into cognition, are they oriented? How's their attention and concentration, their memory, fundamental of knowledge, and you might need to do the MMSE, the mini mental status exam. How's their insight? Are they aware and understanding of their mental illness, and their judgment, their ability to make sound decisions and understand consequences of their actions. After completing the full evaluation, now we want to look at how high their risk is. So we want to identify any immediate safety needs and determine the level of their care. Do they need inpatient versus outpatient? Is their risk low, moderate, high? So we're looking at their suicide and self-harm risk. We're looking at their danger to others. And remember that any time you identify that the patient is at high risk, this means for inpatient stabilization, even if you're working in outpatient. All right, so I will see you guys in the next video.